This has been a great experience for me. And I look out over the audience here and I see an awful lot of beautiful women. I see that there are more men that are taking an interest in this kind of thing for themselves, but I'd like to go back, give you a little bit of history about my own family. I come from a family of, my parents were Depression age generation. My father was a high-ranking naval officer, World War II veteran. My entire family has had elective surgery, and it's not something that I would think in most cases a lot of individuals of that generation would have done. But my father, when he was in his 60s, had very droopy eyelids. He had that done. He had what he referred to as turkey neck, which I also had. He had that done. Matter of fact, my father used to talk about wanting to wear turtleneck sweaters to hide his turkey neck. And so it was something, even though he was a military officer, had a very important job, it was something that was emotional to him, something that concerned him about his own appearance, because it matters to everybody. It matters to all of us. My mom had a very major facelift back when I was in my 20s and she was in her 60s. They had me pretty late in life. And she had, the traditional facelift that was done at that time, which included, she had an acid peel. And I remember her suffering with that to the extent that she would be up at night putting lotion on her face because of the burning sensation that she had with an acid peel. And she took very good care of her skin. I remember she always used to use creams and so forth every night and every morning. She always stayed out of the sun. She always wore a hat. She always wore sunscreen, even though during that time, the 1970s, a lot of people didn't do that. I grew up playing golf a lot. I played golf without wearing a hat, without wearing sunscreen. I did a lot of damage to my skin that lasted for many years. So later in life, when we were married, Catherine and I started talking about some things. Oh, and by the way, let me back up just a second, tell you about my sister. My sister, when she was 59, and she's now 69, she had a major facelift as well. So I'm the baby of the family, and I'm 66 years old. And I started talking to Dr. Horowitz and Stephanie just before my 65th birthday. But Catherine and I had been talking for some time about doing this together, and we had adopted 2 children later in life, and they're now 17 and 15. When we adopted them, they were 9 and 7, and I felt like I looked more like a grandparent. Actually, I was more of an age to be a grandparent to them and not an adopted father. Catherine is very close to my age. She's 3 years younger than I am. But we started talking about this whole process, and we had a friend in Seal Beach. Her name was Nicole. And Catherine saw her at Vaughn's one day and noticed how much better she looked. And she had talked to my wife. She said, I've had a light lift. And Catherine said, well, what is that? And she says, well, make an appointment and go see Dr. Horowitz, and he will tell you about it. And my wife was so impressed with the way she looked. And Nicole was about my age, maybe a little older, maybe 70. And my wife was so impressed with the way Nicole looked that she mentioned it to me, and I said, this is something that I know we've both been talking about and thinking about for a while. Why don't we make an appointment? So on separate appointments, we went and we saw Stephanie and Dr. Horowitz, talked to him about what he would recommend. And that night after I had had my consultation, which was April 30th, 2015. And she said, well, why don't we go ahead and do this? I said, okay, we'll do it. I said, which one of us is going to go first? And she didn't say anything. So I volunteered. I said, okay, I'm going to go first. And so my initial plan was to just do this light lift that I felt I really needed. And to just give you a little bit of an idea, I was in pretty bad shape as far as the way I was looking. And I was very close to my 65th birthday, just a week after I met with them on April 30th. And so I remember Dr. Horowitz walked in and he sat down and he said, well, what do you think has happened? And actually, he was very diplomatic. He was very diplomatic. And I said, 65 years of gravity. And he says, well, there's more to it than that. It's all the sun exposure from all the years on the golf course. And the other things, you know, we live in a part of the country where we get a lot of sun, a lot of us. And I've lived in Southern California since I was 9 years old. Central California, and then Southern California. So I knew that, you know, I was a good candidate for having a lot of things done. Plus, I felt like, you know, the history of my own family was that it wasn't something that was going to be discouraged. Everybody was very supportive. My kids from time to time would say, I'd be sitting there, maybe deep in thought about something. And my kids would say, Dad, are you sad? And I would say, no, my face is just droopy. And I look at my before pictures there, and I certainly see that my face was very droopy. I had a lot done, and Dr. Horowitz can explain much better than I can exactly everything that was done, but in my own layperson's description, I had a total of 9 procedures, 7 procedures in one 8-hour session under general anesthetic. I had the light lift that pulled everything up here, took some fat, tied some cords together, made the incisions. He says, I want to go on the inside of your ear. He says, sometimes with men, they'll choose to go on the outside of the ear because when you make that incision along the ear line, for men, you know, with a beard, then that's just being pulled up, and the part of the skin where you have whiskers is being pulled up, and actually a lot of it's being cut off. So you end up with whiskers on this little part of your ear that you wouldn't ordinarily have. And you know, sometime after the procedure, I could see that you know, I was growing whiskers there where I didn't want them, and then I was pulling them out. But it also eliminated a lot of my sideburn. But to go back to the procedures for a minute, I had, you know, this done under here, this incision under here, which I think has healed very well. And this tissue is still shrinking. Now it's been 15 months since my initial surgery, which was July 24th, 2015. And so now it's October 2016, so that's 15 months ago. The tissue is still shrinking. This is still shrinking under here. The tissue behind my ears is still shrinking. I also had a forehead lift, a brow lift, where he made 3 incisions up here, pulled this all up, and I had such a deep wrinkle above this eyebrow that it would actually pull my eyebrow up. And in the morning when I got up after a good night's sleep, that had relaxed. But during the course of the day, by the time I got home, this eyebrow was actually lifted up like this because this crease was so deep. So with the forehead lift, I did have staples in my head, and then 3 points where he went up from the center and then up here. So that was one of the major procedures. That was, then I had upper eye. I had very droopy eyelids, which were coming down. And one of the reasons my dad had his eyes done was because his upper eyelid was so droopy that it was starting to impede his vision a little bit. So I had upper eyelid done and lower eyelid. And as I understand it, correct me if I'm wrong here, doctor, took a little bit of tissue out from underneath, a little bit of fat, trimmed that off. And then I had what I probably could be 3 separate procedures on my nose. I had a hump in my nose. I had a deviated septum. And I was developing a little bit of a bulbous nose on the end, a little bit like W.C. Fields, not that bad, but it was starting to get there. I do have a history of smoking, which I've quit some time ago. I also had, I've never been a heavy drinker, but with wine over a period of many years, along with a lot of sun exposure, he wanted to shave off the end of my nose a little bit. So 3 separate procedures on my nose. And when I was very young, like 12 years old, I did not have a deviated septum. But by the time I was 18, I did. And I remember my sister saying more than once, she said, "Jim, why don't you just move your nose over a little bit? Straighten your nose." And I was very thin. At that age, I was only weighed about 140 pounds, pretty scrawny. And I think that, didn't have a lot of fat in my face, and it probably accentuated my deviated septum a little bit. But I lived with that for many, many years. And also, when I was 14 years old, I had kind of a bad breakout of acne that I picked at, which of course we never want to do. And my mom would always talk to my sister about taking good care of her skin. But when it came to her son, she didn't really talk about that too much. And I think that that's something that now is very different. I have a 17-year-old son and his sister, who is 15. By the way, we adopted them and their siblings. But they both take very good care of their skin. The products today that they're able to use is much better than what was available when I was young. I used Clearasil and those kinds of things, which looked more like makeup than anything that would, really help you with your acne. But the products today are much better, and my son takes just as good care of his skin as his sister does. But I didn't. Besides all the sun exposure, I had a bad outbreak of some pimples that I picked at, and I left some permanent marks on my nose that I've lived with for 52 years, that I've looked in the mirror at for 52 years. And it has always affected my confidence. So, this whole thing has been about improving my self-confidence. I do feel much more confident in everything I'm doing. I have my own business. I wanted to extend my career even as much as 15 years because I felt that we needed to do that, pay for college educations, which we had not considered before. So this whole process has been very rewarding for me. And the day of my surgery, the morning I got up for my initial surgery, I was actually very excited. I was really looking forward to getting the healing process started. 3 weeks after my initial surgery, which was about 8 hours, I had a second set of procedures because another hereditary factor that I got from my dad, besides the turkey neck, was that he and his brothers and myself, we tend to carry quite a bit of fat in our chest. And I felt that I was about a B cup. And I didn't want, I see myself in the mirror walking with my chest moving up and down. And that was another source of, feeling a little bit insecure about myself, my appearance. So my second set of procedures, which was about 3 hours, was to remove fat from my chest, which now I'm exercising more, I'm taking better care of myself. And also I had a CO2 laser, which was, took all the skin, the outer layer of skin, maybe into the second layer. Does that sound right, doctor? So it took some skin off my face all the way down to my t-shirt line. And so with Aquaphor, keeping it soft, letting it heal naturally, not picking at it, it all washed off very nicely in the shower, the dead skin, and grew back, and my skin is much, much better. But since then, Carly has helped me with some additional procedures. She's done what she refers to as BBL, which is a laser treatment for broken capillaries and also for some brown spots. And I've had some microneedling. Now, the areas that I still have, old, little bit of scarring from, are still getting better, and I think they will continue to get better. And over the next few years, I think once a year or so, I'm going to go ahead and have Carly repeat those procedures just to keep me looking and healing as good as possible. And but I tell you, it's been a great pleasure for me to have worked with the entire staff. I've made a lot of friends. I know I'm taking up too much time. But Dr. Horowitz started out this morning by saying we're not going to have any political comments. But if I could reference one, and that is, it's been a pleasure to see so many beautiful women at the surgery center and at BioSpa. Thank you very much.